Hi, Miss Davis.
Hi.
My name is Corey Vessel, and I'm an occupational therapy student at the University of St. Augustine. I'm going to be doing some therapy with you today. Before we begin, can I get your full name and your date of birth?
Yes, Lauren Davis and June 30th, 1993.
Awesome. And let me just check that hospital band. Yep. Okay, everything matches up. So I saw in your chart that you just had open heart surgery and your vitals and everything look good, so you're ready to start doing some occupational therapy. Did they go over your sternal precautions with you after surgery? I'm sure they did, but do you remember them?
They did go over them, but I don't really remember them.
Okay, that's fine. Let's go over them again. It's a lot to remember. So there's three main precautions. So the first one is we don't want you to lift your arm out in front past 90 degrees. So that's like higher than this angle, okay? And then we also don't want you to lift your arm past 90 degrees out to the side, okay? So the second one is we don't want you to push, pull, or lift anything over 5 pounds. And then we also have this pillow here with you today. So we gave you that pillow in case you have to cough or sneeze or you're deep breathing. Since you have some of that wiring and stitching holding you together right now after the surgery, that just helps keep everything nice and tight and in place. Okay?
Okay.
You have any questions?
No.
Okay, so today I want to work with you on sitting up in bed and upper body dressing. Does that sound like something that you'd like to do?
Yeah.
Okay, so the benefits of this is it's just gonna help you become more independent. Eventually we'll get you sitting up by yourself and putting on your shirt by yourself, or I think you were gonna be able to do that today. So before we begin, I just wanted to let you know that since you did just have this intense surgery, when we do the sitting up or even the dressing, you may experience some discomfort, maybe some dizziness, but that's totally normal. What we don't want is for you to feel any pain or feel like you might pass out or shortness of breath. So if you feel any of those things, let me know immediately and we'll stop the session and move on to something else, okay?
Okay.
All right, great. Before we get started, I just need to make sure I have your consent to get started, first of all. Do I have your consent?
Yes.
Okay. So before we get started, I'm going to just have you lift your neck up, and I'm going to take this pillow out from under you. Awesome. Thank you. I'll just set it to the side. Okay. So what we're going to do today is the log roll method, and it is basically your whole body moves as one unit. So your head all the way down moves together as one towards me, okay? So I'm going to have one hand on your hip and one on your shoulder, and on the count of 3, we're just gonna roll you over to your side, okay?
Okay.
And then after we have you on the side, I'm gonna have you swing your legs off lightly on the side of the bed, and then I'm going to grab you around the shoulders and help you sit up, okay?
Okay.
And I'll be doing most of the work on that part because we don't want you to strain or anything.
Okay.
All right, awesome. So before we do that, I am just going to have you take both feet and bend at the knee and put the feet on the bed. So just like that, awesome. And I'm gonna be putting this gait belt on you, which is just a safety precaution in case you do feel a little dizzy during the treatment. It's just something for me to grab onto easily. So what I need you to do for this is just to push your weight down into your feet and lift up your hips. Try not to use the upper body at all, okay? All right, you can lay back, put him back down. Okay. You doing okay?
Yeah.
Okay. All right, and I'm gonna tuck in this excess so it doesn't get in the way when we're doing our rolling. So the gait belt should be pretty tight, but not too tight that it's uncomfortable. Does that feel okay?
Yeah.
Okay. So before we do the rolling, Yeah, you have the pillow. We're gonna keep the pillow on you. I'm gonna go ahead and put my hand on your hip and on your shoulder, and then on the count of 3, we're just gonna roll towards me, okay?
Okay.
All right. You ready?
Yep.
1, 2, 3. And now you're just gonna take your legs, do them off the bed. Great. Okay, I'm gonna come down here and grab you, and on the count of 3, we're just gonna lift you up, okay?
Okay.
1, 2, 3. Awesome. Okay, so you're not quite touching the floor, so we're just gonna take each hip, scoot you up just a little bit. Great, that's perfect. Okay, how was that? Did you feel any pain or dizziness?
Nope, I'm okay.
You feel okay?
Yeah.
Okay, great. So I'm gonna go ahead and take this pillow away from you.
Okay.
And now that you are sitting up, we are going to work on this upper body dressing. So I had the nurse lay out the shirt for you. Is this shirt okay?
Yes.
Okay. So this is a Superman method. So what we're gonna do is you are going to take the shirt and face it upside down so that the front of the shirt is laying on your lap, okay? And you're just gonna spread it across your hips like this. Can you do that for me?
Yes.
So the collar is facing the floor. Yeah, just like that. Okay, so now you're going to take your hands and work them through the big hole in the bottom. Yep, and start working them towards the sleeves. So while we're doing this, make sure we don't break any precautions. Keep those arms close to you. Take your left hand and go over and just kind of move up the shirt past your elbow. And do it with the other hand too. Just keep in those arms close. Great. Okay, so now what we want you to do is you're gonna go to the collar of the shirt in the front, and you're just gonna start bunching it up until you get to the bottom of it. Yep, just like that, and you make the big neck hole. So now you're gonna keep those arms close, tuck your chin in, and lift that shirt over. Yep. Keep those arms close. Awesome. So now just start pulling it down in the front. Make sure not to break those precautions. Looks good. All right. Yeah, looks good. You feel okay?
Yeah.
Okay, great. Did that go okay? No pain or discomfort or anything?
No.
Okay. So, I'm gonna also go over with you how to take the shirt off. We can do it today, right now, or I can just tell you about it right now, whatever you want to do.
I think I'd prefer to just talk about it since I just got it on.
Yeah, that makes sense. Okay, so to take it off, you basically do the same thing. You're going to be going to the back of your shirt, the collar, keeping those arms down and close to your side, okay? But you grab the back of it with your thumbs and just bunch it up all the way to the bottom, and then you keep your arms close and your neck down, and you just lift it over your head like that.
Okay.
Okay. And then if that isn't working for you, we also have this dressing hook. So this is for if you're putting your shirt on. If for some reason you're feeling some discomfort or anything doing it, or soreness, we are just going to take the hook and it kind of bunches it up. Like how we were doing, but this does it for you. And then you also put your head down and you just kind of start to do your hands down the pole, and it brings it up, and you can do it over your head. Does that make sense?
Yes.
Okay, great. And then for our later therapy sessions this week, I'd like to get you up out of bed and have you go over to your dresser, maybe pick out a shirt, and then have you put it on. Or if that's too much, we can have you go out of, or if we want to grade it up a little bit more, we can have you go out of bed, get your shirt, and put it on standing up. Does that sound okay?
Yeah.
Okay, great. So before I leave, let me take off this gate belt. And do you want to be sitting up so you can watch a little bit of TV when I leave, or would you rather me help you lay back down?
I think I'd rather just sit up. I've been doing enough laying down.
Okay, great. Yeah, the nurses said that you have been sitting up on the side of the bed and watching TV safely, so I feel okay leaving you sitting here. Let me just come back around here and grab this. All right. I'm gonna leave the dressing hook here with you in case you need it. Here is a call bell, and just use that if you need anything. Before I leave, I'm going to give you your pillow back, just in case. So here you go.
Thank you.
All right, you have any questions for me?
Nope.
All right, have a good day.
Thank you.